Hello and welcome to the MoonLens Fast Fit Tutorial 3. This video is on simplifying orthokeratology topography and has been sponsored by the CAT Design Group and your authorized MoonLens distributor. My name is Randy Kojima. For many neophyte orthokeratologists, corneal topography may be a new instrument to the practice. And for those familiar with topography, but just starting ortho-K, there may be analysis options or functions that are unfamiliar. This training tool was designed to address the specific topography considerations that users should be comfortable with. Ortho-K topography comes down to two very important considerations: quality pre-treatment captures and a clear understanding of how to assess the post-treatment outcomes. Consider that the baseline pre-ortho-K topography determines the initial lens parameters, determines the fit, comfort, effect, and success of MoonLens treatment, and ultimately how efficient the procedure goes for you and the patient. With this in mind, the baseline topography is the most important map you ever take. When capturing topographies, have the patient open up as wide as possible. Minimize lid interference, eyelash shadows, and tear wedges on the lower lid that can hinder the coverage and quality of imaging. Ensure that the rings reflect in a smooth, even, and parallel manner. Tear breakup will present as distortion of the rings and can ruin the quality and accuracy of your map. In placido topography, the central rings are the most important for constructing an accurate determination of the eye shape, power, and elevation. In this map, the patient had severe tear film breakup at the moment of capture. Ask your patient to blink regularly to ensure an optimal reflection off the tear film. In cases with immediate breakup after the blink, instill artificial tear prior to mapping. Here we can see an optimal capture where the rings reflect in a parallel and even manner. The lids are primarily out of the way, the eyelash shadows minimized, and the lacrimal lake isn't too intrusive. Most importantly, the central 10 to 15 rings appear ideal. For your baseline pre-fitting visit, never take just one capture. Always collect multiple images so you can confirm the instrument is displaying reproducible maps of the eye. This gives you confidence in the accuracy of the captures. Medmont users should employ the composite eye feature due to its coverage and accuracy in lens construction. The topography capture should allow for the analysis of both the central and mid-peripheral cornea. The data required by the MoonLens is taken over an 8 mm chord diameter of measure. Along with the RX and the visible iris diameter, the MoonLens calculator will design a highly customized ortho-K lens for each individual eye. This is why the quality of the baseline captures is so important. Accurate information going into the MoonLens calculator creates a high first fit success. After your custom lenses arrive from your MoonLens distributor, evaluate the fit, train the patient, and schedule the overnight wear visit. When the patient presents after one night of wear in their MoonLenses, perform a thorough slit lamp exam and check the acuity. You may want to show the patient what the uncorrected acuity was prior to treatment and how that compares to the visual improvement after just one night of wear. Then it's time for the post-fit topography capture. After mapping, you want to use the topography function called the subtractive map. Some topographers call it a difference or comparison map. First, select the baseline, pre-ortho-K topography. Then, select your best post-treatment topography. Next, select the subtractive function, which compares the before and after, then shows you the difference. This is without question the most important and most valuable analysis option that your topographer provides after Ortho-K wear. The subtractive map will describe the outcome of orthokeratology in one of four principal ways. The bullseye is the ideal response to wear and the goal of treatment. The central island creates apical steepening and requires a lower depth and looser alignment zone. The smiley face indicates a high riding lens during sleep and generally should have a steeper alignment zone to improve centration. The frowny face presents as a low positioned effect and normally indicates a tight alignment zone. Each of these post-treatment outcomes tells you exactly what you need to do next. And the subtractive map function is the key to this analysis. Understanding the importance of this tool cannot be overstated. The subtractive map will allow you to analyze the outcome in multiple ways. One of the principal views is called the axial interpretation, which is known in some topographers as the power or sagittal map. The axial map describes the position of the treatment zone. In this case, the epithelial change and effect is perfectly centered to the pupil. Additionally, the axial map can tell you the RX change created by the MoonLens. Click your cursor on the center of the visual axis or center of the map and determine the power change between your pre- and post-wear topographies. The axial map also displays the size of the treatment zone and provides insight on its contribution to visual function and aberrations. A tangential subtractive display is the second analysis option you are likely to want to use in post-wear analysis. It describes one thing only: the position of the lens in the closed eye environment. Note the location of the red ring in relationship to the pupil. The red ring highlights the epithelial steepening created by the deep paracentral reservoir of tear that the reverse geometry lens creates. The outer blue ring is the alignment zone, which is touching down on the mid-peripheral cornea and creating the circular flattening seen on the tangential map. Both the red and blue rings of epithelial change describe the exact position of the MoonLens during closed eye wear. The bullseye is the goal of orthokeratology treatment and tells us the lens is correct. It has the correct depth, the correct alignment zone to center the lens, and overall the correct fit. It's possible for the bullseye to be associated with an under or over correction. But when the bullseye is present, it tells us we are very close to the perfect outcome, or that we are already there. One helpful and relieving consideration is your MoonLens distributor is here to support you through this process. The initial cases can be reviewed with your consultant to ensure the optimal outcome is achieved for your MoonLens patients. Export the digital topography files and any slit lamp images so your MoonLens consultant has the full picture. Together, you will quickly learn what to look for and how to assess the findings. To summarize, spend the time on the baseline capture. It's the most important topography you take in orthokeratology treatment. Take multiple images or a composite map to ensure you have the best possible captures. Learn how to use the subtractive map, as it will provide a clear and definitive understanding of the changes you make to the eye with the MoonLens. Thank you for your interest in the MoonLens. Don't hesitate to reach out to your MoonLens distributor if you have any questions.